Well, I guess we should get started, everybody, because we want to give ReAuta enough time to do a presentation. Good morning. I'm Barbara Derrick, and I'm the Executive Director for Smoke Free SC, and we're excited to have y'all here today. I'm going to turn it over to Tara to introduce our speaker and any notes that we have. Thanks, Tara.
Thanks, Barbara. So thank you all for joining us this Friday morning. As Barbara said, we're excited to have ReAuta Scott from DHEC here this morning to talk about some exciting programs they have going on. At the end of the presentation, I'll give a quick preemption update sent by Beth Johnson. She's unable to be here today, but she did send some notes, so I'll just go over those. So if you're able to stay until the end to hear those, that would be great. As always, the meeting is recorded and it will be posted on our website and our YouTube channel next week. So if you have questions that you want to go back to watch the video, if you want to share it with anyone else, it will always be on our website as well as our past videos. So I'm going to pass it over to ReAuta. I'll let her introduce herself and she'll get started with her presentation.
Hey, can you hear me okay? Okay, good. So thank you, Tara, and good morning, and thank you all for your time this Friday. Again, I am ReAuta Scott, and I am the Community-Based Tobacco Disparities Coordinator for the Division of Tobacco Prevention and Control. And this morning, I will be presenting an overview of the Community-Based Tobacco Disparities Program, or the CBTD program. So my goal this morning is for you all to walk away with an understanding of the program's requirements, the required activities for year one, which focused on creating the foundation of the program, and also the current activities and strategies for year two. So the CBTD initiative is a four-year program that is a requirement of our division's cooperative agreement with the CDC. And the program uses a community-led approach to impact a selected community in the state that is disproportionately affected by tobacco use. And we were required to select the community based on geographic regions in the state with the highest levels of adult smoking rates and the lowest levels of smoke-free, tobacco-free protections. So for this program, we were required to select and fund a local community organization to lead the initiative. And this organization is referred to as the local lead agency. And the local lead agency is required to either develop a new coalition or partner with an existing coalition that represents the target community. And the local lead agency and the coalition then work together to determine an issue that they would like to work on, and then develop a work plan to address that issue. And it's important to note, because this intended to be community-driven, the coalition was not required to be a tobacco-focused coalition. And our role as division staff is to provide support and resources to aid the local coalitions and the local lead agency's efforts. So with this program, community is key. Community is driving the efforts of the program. And I think a saying that really captures this approach is not for me without me. So with this community-led approach, there's an acknowledgement and appreciation that the affected community is more than capable of addressing and identifying its own issues. So therefore, our role is to provide that affected community the support and resources to do so. So for year one, we were required by the CDC to complete specific activities that focus on building the foundation and creating those necessary partnerships to get the program started. And one of those activities was the selection of the community that we're hoping to impact with this program. So the selected community for the CBT program includes Dillon County, which is a rural county located in the PD region, which is known for its history of growing tobacco. It has a population of about 28,000 and an adult smoking rate of 26.2% compared to the state rate of 18%. So it is tied with Barnwell County for the 7th highest adult smoking rate in the state, and it has the 3rd highest adult smoking rate in the PD. And also it does not have a local county ordinance. So the selected community for the CBTD program also includes Allendale County, which is located in the Low Country region of the state. It has a population of 7,800 and an adult smoking rate of 27.7%. So it has the 6th highest adult smoking rate in the state and the 2nd highest adult smoking rate in the Low Country. And like Dillon County, it does not have a local county ordinance either. And with the selection of Allendale and Dillon counties as our targeted community, it offers us the opportunity to impact multiple disparities, such as low SES and rural, which we all know are disproportionately affected by tobacco use. So another required activity for year 1 was to partner with a local community organization to lead the initiative. And for the CBTD program, we have partnered with Hold Out the Lifeline, a mission to families, which is a statewide nonprofit that was established in 1990. And their mission is to enable its partners, faith and community-based organizations to address the holistic health of families in South Carolina. And HOTL has a long history of working with the agency's chronic disease areas to include opioid prevention, cancer, injury, COVID, and also tobacco prevention, and also has a history of commitment to working with various populations to include rural, African American, and low SES. So the 3rd activity required in year 1 was community engagement and coalition development. And for this initiative, the local lead agency, Hold Out the Lifeline, chose to develop a new coalition for this program. So using a community-based participatory approach, HOTL partnered with local faith and community-based organizations to identify, engage, and recruit coalition members. And this community-based participatory process allows community members to be equally involved in all aspects and parts of the process, to include what issue they would like to address and how they would like to address it. And both the Allendale and Dillon coalitions have identified tobacco use as an issue that they would like to work on. So HOTL has worked with both coalitions to develop work plans to address tobacco at a local level. And to engage with community members, HOTL and coalition members attend other local organizations, meetings, and events in the community. They also partnered with local community organizations to host events as well. And HOTL strongly believes in the educate to advocate approach. Therefore, coalition members were trained on tobacco prevention, the South Carolina Tobacco Quit Line, secondhand smoke and vaping aerosol exposure, and also the benefits of living smoke-free, tobacco-free, and the importance of clean air. So HOTL has developed diverse and representative coalitions for Dillon and Allendale counties. So the Dillon Coalition currently has representation from fraternal organizations, faith-based organizations, health service providers such as Care South Dillon, McLeod Dillon. It also has representation from youth organizations such as the Dillon Boys and Girls Club. The coalition also has representation from our PD regional office. Also, they have representation from individual adult and youth community members as well. And the Allendale Coalition also has representation from faith and fraternal organizations and also health services organizations as well, such as the Allendale County Hospital. And the coalition also has representation from local community members to include adults and youth, also from county council, city council, an emergency food pantry in the area, and also New Life Drug and Alcohol Allendale. And an example of a community engagement activity that was hosted by HOTL and the coalition was the Dillon County Youth Event, and this did occur in year one in March of 2022. And the event was hosted in partnership with the Dillon Boys and Girls Club. And this was an opportunity to engage with the local youth. They were also provided education on tobacco, nicotine addiction, and e-cigarettes. And both the Dillon and Allendale coalitions hold these youth events on an ongoing basis to continue engaging the youth and also to inform their efforts targeted at the youth and tobacco prevention. Another activity developed in year one is the Clean Air is Fair initiative. And this initiative uses printed materials to include infographics, key point pages, yard signs to promote smoke-free, tobacco-free policy and spread the word about the benefits of clean air. And so yard signs and also key point pages have been handed out to community members at events, also to organizations represented on the coalition for them to distribute. And they also are looking into having billboards posted in the community as well. And so the activities for year two, which is the year that we're currently in, are focused on implementation of those activities outlined in the work plan. And those activities include continued coalition building and maintenance, to include establishing new partnerships and also continuing to strengthen those current partnerships that they have in the community. Another activity is the promotion of voluntary smoke-free, tobacco-free policies, starting with organizations represented in the local coalitions. Also, quit line promotion activities will continue in year two. In year one, coalition members were educated about the quit line, and also quit line materials were given out at local events. In year two, these activities will continue because we really want to get the word out about the quit line to the larger community, and also increase referrals from those local health service organizations as well. For year two, there will be continued promotion of the Clean Air is Fair communications to get the message out to the larger community about the importance of clean air, and also to promote smoke-free, tobacco-free policy. And also with year two, one of the activities is the promotion of personal cessation and secondhand smoke stories, which are videos of personal stories from community members about how and why they quit using tobacco, and also how they've been affected by tobacco use and secondhand smoke and vaping aerosol exposure. And I wanted to share one of the first personal quitting stories that have been developed by HOTL and the Dillon Coalition.
Hello, everybody. My name is Lisa Moody, and this is my story of not smoking. I am the daughter of a family that has grown tobacco for hundreds of years. Me and everybody else in my family, we all started smoking very early in life. It's just what you did. On July 20th, 1995, I had a life-changing moment. I was getting my lifeguard certification, and I hopped in the pool, and I had to swim 26 laps to be certified. Doesn't sound like a lot, but after you smoke 2 packs of cigarettes for many, many years, it's almost impossible. I've done 3 things in my life that have been truly difficult. The first one is to quit smoking. I birthed a child, and I got a Class A CDL to drive semi-trucks in rush hour traffic in Phoenix, Arizona, in a big semi-truck. So those 3 things have taught my life. And I put quitting smoking as the top one, but it truly has been the most difficult one. It will always be an addiction that I have, but it's conquerable. And no matter what you think, you can't put that cigarette down. You don't need a life-altering moment like I had.
to make those choices to change. It might just be a moment because you're having a child, or you don't want to feel sick anymore. You don't smell that way anymore. Maybe you want some more money in your pocket. There's a lot of reasons to stop and quit smoking. But think about yourself first and what it'll do for you, and then that'll do stuff for everybody else. So good luck in your journey. There's a lot of helpful tools. There's hotlines. I didn't use chewing gum. I didn't want to have a crutch, so I just chewed a lot of chewing gum, did a lot of exercising, meditation works, yoga works, food works, whatever it takes to get you through it. Just think about what it does for you and those around you as well. So good luck. And my name is Lisa Moody. I'm 54 years old now, and I have not smoked since I was 25 years old. I don't know the calculations, but it's been many years, and I'm very proud of myself. Thank you.
Go smoke free. Visit holdoutthelifeline.org for more information.
Okay, and again, the purpose of those personal stories is to put out that messaging to the community about the importance of clean air, and also to promote and increase awareness and use of the South Carolina Tobacco Quit line. And that concludes the activities for year one, and also the current activities that are occurring in year two. So in conclusion, the CBT program is what we refer to as the kitchen sink program, because it includes a little bit of everything. So it's a community-led effort that includes many areas of tobacco to address tobacco-related health disparities in Allendale and Dillon counties. So there's the smoke-free, tobacco-free policy piece, and currently the activities are focused on voluntary policy, specifically within organizations represented on the coalition. There's also the communication and messaging piece, the creation of printed materials, videos, really targeting that message to promote clean air and use of the tobacco quit line. Also the youth prevention piece with the youth events, continuing to engage with the youth, and also the promotion and prevention piece as well. So it's a lot, and it's definitely a team effort, but we are very pleased with our progress so far in all of HOTL's and the coalition's hard work. And we're excited to see what we can achieve with this current year, and also throughout the course of this project. So that concludes the presentation piece. So I hope you all have a better understanding of what the community-based tobacco disparities program is, what some of the requirements are, and what some of those activities that are currently occurring out there in the community, and also our partner with this initiative, Hold Out the Lifeline. So now we can take any of your questions or comments.
ReAuta, I just want to say that's a great presentation, and it's so exciting to see new work being done in new counties. I mean, it's a thrill. I love to see new coalitions. It's something built. It's something we struggle with here at Smoke Free SC, is how to even do this. So just excellent work. Thank you so much for sharing. I guess we had a couple of questions in the box. I think most of them have been answered by Helen and Catherine, but I'll let anybody else jump in and ask a question. I have a few when y'all get done.
Okay, and I'm going to go ahead and put up our contact information. So my contact information, Helen, who's the CBT team lead, and also this secondhand smoke and vaping aerosol protection coordinator, and also Dolores Scott, who is the executive director of Hold Out the Lifeline.
I have a quick question. I assume the school districts in these two counties have adopted the 100% tobacco-free policy. Is that true?
That is true. Right, Helen? I believe that is true.
That's correct. The only county that doesn't have policy is Lee County.
Right.
And they are working on it hard, Dave. They hope to get leaves sometime soon. They keep sending, I think, letters to inform them that they need to be in compliance. Nice letters, of course, but absolutely. And then ReAuta, I think we have one of the two coordinators for the coalitions on the line as well. Did you want to mention them for Hold Out the Lifeline?
Okay, sure. So who's on the line? I'm sorry, I can't see anybody.
I'm sorry. Ava Dean's on the line. She's
Okay,
waving.
Ava.
And then the other one is Vicky Shepherd, who is the coordinator for the Allendale County Coalition. I'm a little slow this morning. I'm not as young and perky as ReAuta, but she did a great job. I haven't had enough coffee.
Okay, yes. So Dolores would hold out the lifeline. She also works with 2 program coordinators, one for each county. So we have Ava Dean, who's the program coordinator for Dillon County. When we also have Vicky, who is the program coordinator for Allendale County as well on the call.
I had a couple of questions. How do you share the local stories, the videos? Where are they shown? Are there websites for each of these areas, or?
Right. So my understanding is the video is currently on the Hold Out the Lifeline website, but they're also working with Kathy, who's our communications person in the division, and they're working with her to strategize on ways on how to promote those personal stories and get those out to the community.
Right. What were the challenges in trying to set up local coalitions? What are some of the issues you ran into?
So if Ava or either Vicky want to speak to that, I can kind of give some like general things. I know just from our perspective, the timing of the coalition development kind of created a challenge with it because we were still in the middle of COVID. So there were a lot of reluctance towards in-person meetings. And I think Dolores having those relationships in the community, I think that helped address those challenges, and also being flexible and offering like virtual meetings, and also having those meetings with community members in the evenings, and just allowing them to be flexible and meet them where they are.
Ava put in the chat box, just to go back to you, ReAuta, Ava put in the chat box that I think she and Vicky are both in a training right now, so they're unable to come on to speak.
Okay.
Just-
Okay.
Yeah, I think Ava said also that one of the challenges that they faced was getting local members on board, and they had some members that were smoking still. So, you know, they don't want a smoke-free policies, either voluntary or not. I mean, I think we at Smoke Free SC would love to see more counties involved, and get ourselves involved too in trying to at least learn how to build coalitions. Is this program going to expand, and how long is the time frame for this project?
So for right now, it's a 4-year program, and we're currently in year 2. We are hoping to be able to expand the program. However, we're unsure, but we're really just focused on what the current activities and strategies with this program, and once we get the momentum going, we can possibly expand it to other counties within the PD area, because there are other counties in that area with high adult smoking rates as well. So yeah, once we get to the momentum going in these counties, we are hoping to be able to expand it and utilize some of the lessons that we learned in these counties and be able to use that to apply it in other areas as well.
Yeah, it's a great model for coalition building.
Mm-hmm.
Hi, Ms. Scott. This is Mrs. Woods. I have a question to ask for you. I'm very interested in these data that you gave. Both Dillon and Allendale are very close and personal to me. My husband is down from the Marion area, and I'm from the Barnwell area, so we are very familiar with these areas. The population that you chose to do your surveys on, I'm assuming you said it was just all adults. What age did you start with? Was it 18, 17, or how low or how high did you go as far as when you started, when you said adult percentage?
So that data is from our 2017-2018 adult tobacco survey. And I'm assuming the adult range starts at 18 years old. Is that correct, Helen? Do you know?
I do believe that is, and I bet Jaren has chimed in. Yep, there's Jaren, starts at 18, exactly. Thank you, Jaren. It's a good question.
So have we, or have you all been able to tap into the younger population? And I'm also interested because I see that both Ava and Vicky are doing mental health. I am a therapist, so I'm interested to see how much those two are cohibit both the, I want to say alcohol, but because I just did alcohol training, but tobacco and the mental health. Are we looking at the correlation between those two as well?
Yes, so we're currently, right now, our activities are kind of focused on listening to the voices of the youth and really engaging with them and getting feedback on them on their perspective of what the problems are and how they should be addressed. And right now we're in year 2. And so we do have a bit more time to be able to kind of focus in those efforts on the youth and kind of be able to use that information to tailor those interventions to the youth to hopefully impact the youth use rates as well.
Okay, all right, thank you.
I know one of the things we always talk about, especially being at a state level, is letting a coalition speak for themselves and for the needs in their county. And I know Ava and Vicky can't really speak to that, and they're probably more boots on the ground than in that area. But I was just wondering, was it hard for them to the areas to define what their interests were? And is it hard for y'all not to put your interest on top of theirs?
Mm-hmm. Yes, that's definitely a challenge with using this type of approach, because you want to let the community drive the efforts. But at the same time, there are like certain, there's a framework that we have to follow, and also that there's certain targets that we would like to reach as well. And I think it's about finding the commonality in both parties' interests and everyone's interest, and going from there and seeing, okay, well, maybe you may not want to work on something tobacco related, but we're able to identify resources within the agency that may help them address that other issue as well. I know one thing that we did early on was to create a community resource guide where we use different health focus areas that may be of importance to the community and identify resources within the community that may help them, aid them in those efforts as well. So yeah, it's definitely a balancing act, but like I said, it's important to find like what is something in common that we both want to achieve and work with each other to work that out and help each other.
And I did step out. So hello, everyone. I stepped out of the meeting just for a little bit, just to chime in. And ReAuta is correct. It is a balance in that. And you said it perfectly, ReAuta. It is something that we had to acknowledge at the very beginning, that this is their coalition and we make it evident to them. This belongs to them. And letting them know that what they're suggesting and what they would like to do is where we go. And it's just really steering them in the right direction. And it's being there, you're on the ship and you're saying, okay, this is what we want to do, and gently maybe giving suggestions, but allowing them to be the one that say, come up with the ideas and everything. So it is a balance in that, but we've been able to do that. So we may come to the table with, hey, here's a study. So what do you think we should do about this? Or what do you think we can go with this? And like I was saying earlier, we just brought the study that talked about the increase with middle and high school with the tobacco usage and stuff. So where do you think we can go with this? And she asked the question about the mental health tie-in. We are getting ready to focus on that in ReAuta. Y'all will see this in our report for this month, that we can focus with youth and tobacco use and see how this may move us forward with coming up. So it's a definitely balance act, but we have seen the increase with allowing them to move us forward and not us. It's been great, because if you allow them to do it, I believe that's where the sustainability will come forward. They will feel like it's theirs and not ours.
Good point, Ava, good point.
Ava, did you mention a CHIP? Do you have a community health improvement plan in place in your county?
No, I didn't say that. but no, I didn't say that. But I did say that we are working with Rally, who is working with DHEC, who is doing the CHIP. So I work, as ReAuta said, we work on, through the coalition, we are on certain committees where we're able to make the coalition visible in the community and stuff. So I know that DHEC is working on CHIP. And so I'm trying to throw in tobacco to make sure that, hey, you know, Dylan is a part of this, or as far as the coalition is a part of that. So no, but not no.
Okay, I just, you know, we're just finishing, we've had our data walk and we're finishing up our, you know, drafting our community health improvement plan. So that's why, you know, we've been able to incorporate some tobacco items from our coalition, you know, involvement into the CHIP. That's what I was kind of.
Well, I can tell you that Daquasia with DHEC in the PD area is doing an excellent job with trying to make sure that we get it incorporated in Dillon. She's doing a great job.
So Ava, I don't know much about the local communities, but I did want to ask this question. When we go out and talk with people in certain areas, and they think they already have smoke-free policies in place because they don't see smoking in restaurants or bars or that type of thing. Is that true in y'all's rural communities, or do people still smoke in those areas over, you know, a lot? I guess I should say.
I think it's both. I think they did not know, and I think they do still smoke.
Okay.
They do still smoke, and they didn't know. So it's been an eye opener for them, and it just boils back to education. As we've been in these events and we've shared information, even for those that have smoked, just a simple education on what cigarette smoke can do to you. Some of them simply did not know. And it's, oh, this can do this to my body, and letting them know that it's been, oh, I'm going to stop. So that let us know that, hey, we're doing something here, which is exciting in that part. So beginning that conversation and moving forward, it's exciting to be in this place and what we're doing now. So it can be as simple as the education is moving forth and what we're trying to do with gently pushing in the policy and stuff. So yes.
We found with the work in Greer, South Carolina, is that a lot of their residents and even chamber members thought that policies existed because they don't see it on a daily basis. So then they were reluctant to kind of do anything because it's not a problem. So I just wondered if you had that same thing, but it doesn't sound like you do. Anybody else have questions?
I just wondered, in either county, you mentioned that you're trying to figure out ways to reach youth. Have you been working with anybody? I think you mentioned someone was working on communication with social media. We've had a lot of success with, you know, free social media in York County.
I know with Dylan, we work, the Boys and Girls Club, Annie has a center, and then we also have Teresa Purnell, who owns a after school service as well. They, with their centers, we've been able to bring in the youth, and that has been great. So we've done a program with them. Actually, we've done two now with the youth where we've been able to educate them. So having them on the coalition has been great. We've been able to do that. And then we actually had a senior last year that was on the actual coalition. She gave us great suggestions. So with them
Mhm.
being on the coalition, that's helped a lot with being able to reach the youth in Dillon.
Right.
I have a quick question to ReAuta or Ava or Helen, anyone involved on the project. Do you think it's been successful or an obstacle choosing a nonprofit that had been existing in the community? You know, I think you said since 1990. Because I feel like there would be strengths there. It's a program that the community already knows and trusts. But were there any obstacles also associated with that?
No obstacles that I'm aware of. If Ava or anyone else wants to chime in, but I think it's definitely a strength in that those relationships were there in the community. So it wasn't as challenging going into those community recruiting individuals, identifying who needs to be at the table because those relationships were already there and that trust was there as well.
Perfectly said.
I agree. We've had a long-standing relationship with Hold Out the Lifeline, and as ReAuta had mentioned earlier in the presentation, that they have done quite a bit of chronic disease work and risk factor work. And then you're exactly right, Tara, your assumptions of they had the established relationships. And, you know, that's really the hardest thing when you're working with communities is the trust factor, and people already knew of, had worked with Hold Out the Lifeline. And so the trust was already established. So they were able to really speed up the process. For South Carolina compared to the rest of the country, we are ahead of the game. So we hear this from CDC, who's our funder. We hear this from the communities of practice. We hear this from the Geographic Health Equity Alliance, that we're just so fortunate that we have been so successful. They've had such great progress with the communities and moving forward with their work plans. Some other states haven't even been able to get their bid out to contract with a local lead agency.
Right.
Some states have bid out, but unfortunately they have awarded their funds to local lead agencies that aren't as well established, and they are kind of confused about the process, and they haven't been able to recruit people to their coalition. And then other stories that we hear, or actually reports, it's all true, is that they can't maintain their coalition and they don't have any work plans in place. So we are in a very good position to not only be successful in South Carolina and to put into place, hopefully, those clean air protections, and to also hopefully decrease those usage rates for adults and youth, but also to be a good example for other states so they can hopefully, you know, learn from some of our lessons, learn from our successes. We like to share that information and reach out and provide help as much as we can.
Yeah.
That was great to hear. Good, positive words. Okay. Any other questions or comments?
Thank you both very much. Ava, thank you so much. And we're sorry to take you away from your training, but you really gave us some great insight there. So thank you for jumping in. We appreciate it. I did want to point out to everybody that we have 3 board members on the call today, which is great. We have Avita Woods, who's serving on our board, Sharon Biggers, who's on our board, and Tammy Timms. So thank you much to our 3 board members for attending. And I'm going to turn it back over to Tara.
Yes. So as I said at the beginning, I am going to give a quick an update that Beth sent on preemption. Hopefully you receive her emails. If not, I can get your email address added to her recipient list. But unfortunately, Bill S414, which is the South Carolina bill that is addressing preemption throughout the state, it was passed through the Senate Medical Affairs full committee. So it went through the subcommittee first, subcommittee voted it through to the full committee, and now the full committee has passed it on to the full Senate. as we know, if we've discussed it before, preemption is something that we don't want in our state because it will take away local rights from local communities to establish different TRL and flavor bans, things like that. So I'm going to just read some notes from Beth's email, and hopefully she'll, she's great about sending updates about what we can do, what we should do, what to be on the lookout for. So this is the last email that she has sent. And as she sends out more, we'll definitely reach out. We send things out through our constant contact to be on the lookout for. We send out an opportunity to sign a statewide petition. So if you don't receive our constant contact information, you can put your email address in the chat bar and I'll make sure to add you to it, or you can go to our website and do it through there. So this is what Beth recommends that we should do. She's working on asking senators to put their name on the bill in objection. She says what's next is we need to prepare to fight off bad language in the TRL bill and prepare testimony for, against the bill, prepare amendments for S414 to be offered on the floor, state TRL plus flavors, a penalty on retailers, remove the zoning ordinance language because of the current Myrtle Beach lawsuit, media around the uniformity of laws, loss of revenue. So at the subcommittee meeting, that was the big argument that the representative from the South Carolina Petroleum and Convenience Store Association had. He didn't, that loss of revenue, the loss that the state would have. And Beth countered with the cost, the medical cost that we spend, the state spends on individuals suffering from disease and illness related to tobacco use, but that very large difference really didn't seem to matter to some of the senators on that subcommittee. So that's their big focus. They're focusing on the loss of revenue, but they're also focusing on how South Carolina needs to be uniform in their laws. So those are the two big focuses that got brought up at the subcommittee meeting. She wants us to ask the following senators to object: McElveen, Sin, Shealy, Hutto, Kempson, and Cash. So if any of those people are your senators, you could reach out. She wants us to distribute the cost of tobacco one-pager on their desks and tweak the language, work through statements about uniformity of laws, the good and the bad of that, and prepare for the bill to move on to the House and how we can slow it down. So just staying updated about what's on the agenda and try to stop the bill from receiving a hearing. So that's all that was in the email. And as I said, we'll keep you updated with anything else she sends out. Hopefully you do receive her emails and you receive our constant contact, which also has updates.
Tara, can you speak to the lawsuit in, I think you said Myrtle Beach? I'm not aware of that.
Yeah, so Myrtle Beach, I don't know as much about it as Beth does, but Myrtle Beach has been doing a lot of work, the mayor, with trying to restrict the number of vape and tobacco shops that have been opening up in the city. The boulevard or the boardwalk, they were just popping up everywhere. She really wanted to keep it family friendly. So Myrtle Beach has been doing a lot of work in restricting access, zoning laws. And I think with one of the fears of this bill is some of that being taken away or not being able to continue happening in the future. But I don't know about, I just read, I do not know about the lawsuit. Barbara, do you know about that lawsuit?
I do not.
Okay,
I'm sorry.
so I can reach out for more clarification on that.
Well, that was a good kind of overview and just general information about it. So thank you. I appreciate it. I think, Barbara, in the chat that Alan had a question.
Let's go check. January 26th, 20 review on tobacco for the U.S. states. Alan, do you know who presented that review?
Yeah. Was it the American Lung? Is that the one that South Carolina got the F on?
The F on?
For the 10th straight year.
Yeah.
Right? I hate it when that report comes out because I know what it's going to say.
Yeah.
Yes,
Oh,
yeah.
yeah.
Although we do get a much better grade, I think, every year for cessation in the quit line. So there's some saving grace there. I can hold my head up when I leave my house. However, my area, yeah, F, thanks so much.
Yeah.
Yeah, I think we shared that article on our website, so I can go check, and if we did, I can copy. Yeah, here it is right here.
We'll put the link in the box.
I'll put the link in the box right now.
I think one of the provisions within the retail licensure bill was that it gave penalties for purchase, possession, and use, the PUP penalties, and I think
Yes.
it's something that they're working against.
Yeah.
They want penalties on retailers, but not on the
Not on the youth.
purchase and use. Yeah, and I just lost my train of thought. Oh, and earlier this week, I believe City of Columbia did a zoning bill to restrict the number of retailers. At their meeting, they set an ordinance in place. I'm pretty sure that's who it was.
Yeah, good job, Columbia. Right, Ellen?
So
So if there are no other questions or comments, our next meeting is March 24th. We are working on having a speaker, hopefully from the campaign for tobacco-free kids, because the following Friday, March 31st, is National Call to Action Day. And hopefully we'll have a speaker from them speaking more about that day and what they're doing across the nation to, create advocacy and promote advocacy amongst youth. So we will share those details as soon as they're finalized, but March 24th, 10 a.m., same place, same time. And we'll put that link in our e-newsletter and on our constant contact. Yes, Dr. Keeley?
Yeah, I just want to mention to Ava, some of us have had a good experience with passing ordinances for smoke-free indoor workplace protection with the emphasis on workers. And if we can be of assistance, our coalition in York County would be happy to talk with you, if you want some direct experience that we found to be useful, because it really is all about the workers, and you can actually get the hospitality folks to buy into it, because they get frustrated with their employees all want to take smoking breaks, and the non-smoking employees feel like that's unfair. So there's several things we can share that I'll be happy to be contacted by you. Helen knows how to get a hold of.
Thank you, Dave. Great
Thank you.
points.
Thank you, Dr. Keeley. So in the chat, I just shared two things. I found an article about that Myrtle Beach lawsuit. So evidently the stores in Myrtle Beach have sued Myrtle Beach because of the ordinances that were passed. Evidently it's been in the making for 4 years, and it has reached the Supreme Court, I think. Yes. So I just shared that article in the chat so we can all read and learn more about it. And then Helen also asked the date for the Smoke-Free SC Annual Summit. We announced it in our newsletter, just the date. We haven't given very many detailed instructions yet, but it's going to be Tuesday, May 16th in Columbia, the same location where it was last year. So go ahead and put that on your calendar. We'll present more information about it next month, the link to purchase tickets and where lodging, everything, we'll give all that information next month, but it is going to be Tuesday, May 16th. And we hope you all can attend.
I was trying to put the article that Sharon had sent me about the new rules in the city of Columbia on vape shops, but I can't get it to copy in there. But we'll send that out in our next newsletter.
Any other questions or comments? All right. Well, thank you so much, ReAuta and Helen and Ava, for participating today and sharing with us, your project, and Dylan and Allendale. I hope this new year, I guess you're going into year 3, starting in May. I hope it's successful and you have a lot of positive outcomes. We appreciate all that you do for tobacco work in those counties. And thanks everyone else for participating today. Again, we'll be here next month, March 24th. So we hope to see you all then.
Happy Friday,
Thank you.
everybody.